Good afternoon, everyone. I see that we've got 75 participants on at the moment, and I know that a number more have registered for today. So it's a good number for us to kick off with this exciting discussion. And I really must thank everyone for your participation at fairly short notice as we got this up and running with respect to this critical engagement webinar series, Pandemic Pangolins, Systems, Science and Society. My name is Adjunct Professor Richard Cooke, and I'm the head of the Department of Family Medicine and Primary Care. And it is indeed on behalf of the department and on behalf of Health System Sciences as one of our undergraduate programs and the Adler Museum of Medicine that I really want to welcome you all to this webinar series. We've broken it down in three particular areas: pandemic crisis, lessons, and indeed innovations. Looking at taking as holistic and integrated a view as possible across the 11 webinars that we are hosting on these Wednesdays, 1300 to 1400 for the next 11 weeks. But I really am very happy to welcome you to the first of these, Counting the Cost of COVID, Economy, Gender and Health. And it is a critical topic. And it's fantastic that we're able to come together as from many different disciplines, looking at the cost of COVID, and really for the purpose of this webinar series being to look at the interlinkages. I know that we've got many participants from different disciplines, be it from health, be it from economics, from sociology, and many others. But ultimately, we're all in this together. We are all part of the same systems and it is with a systems thinking lens, or indeed through multiple lenses that we can look at this latest pandemic and its challenges, its solutions as well that we can potentially come up with. So a big welcome in particular, if I may, to Professor Imraan Valodia, and indeed Associate Prof. Daniela Casale. Imraan is Professor of Developmental Economics and Dean of the Wits Faculty of Commerce, Law and Management, head of the Southern Center for Inequality Studies at Wits. And Daniela is Associate Professor of Economics within the School of Economics and Finance, also within the Faculty of Commerce, Law and Management at Wits. So how we'll structure this is we'll give sort of 8 to 10 minutes or so to both Imraan and Daniela, both one after the other. Then we'll engage a little bit around specific questions, and certainly be following the Q&A box. So please do put your questions in, colleagues, and then we can have a rich discussion thereafter. So thank you both to yourselves and to our presenters, and allow me to kick off with Imraan and to hand the floor to you.
Can I start by just saying how pleased I am to be here? Thank you so much for the invitation. So I was asked not to be too kind of economic and to try to make to kind of render the discussion something around what are the main kind of questions that are concerning me about the economics of the pandemic. And the issue that I'm sort of really currently kind of thinking through is the kind of reconstruction phase of the economic question. So how do we reconstruct the economy in a way that is going to address the problems of the past, but also the kind of deep kind of economic problems that we have and that we have had for a long time. And the kind of essence of the problem that I'm thinking about is that while our economy had a kind of huge a number of problems for a long time, there was kind of sufficient kind of growth, and there was sufficient kind of economic policy transfers that basically kept the economy operating. And my concern at the moment is that what the pandemic has done is to really undermine that little consensus that we had. And it throws up a challenge about what are we going to do about getting the economy growing, but also addressing all of the all of the deep structural problems that we have. So let me talk about it in terms of what we had, where we're at, and what might be a way to kind of reconstruct the economy. So we kind of unfortunately entered the pandemic with some really deep structural problems. So we have unemployment that is close to 35%, and we've become used to that. But I think it's a kind of truly remarkable thing that the economy is kind of unable to provide a job for approximately 4 in 10 people. And I think that's what we had before the pandemic. We also sort of have one of the most unequal societies in the world. And I think we saw in how the pandemic played out, how that inequality kind of really shaped different parts of the population's experience of the pandemic. And I just want to share one slide to just make it easier for me to talk through this. Can I just check? Can you all see the slide? So it's a slide that shows you.
Can, Imraan. I certainly can see it. Thank you.
Okay, so what the slide shows is what is the wealth status of different parts of our society, and if you take the bottom end of the distribution, basically 50% of our households currently sit with about minus 16,000 as their net financial position. So kind of if they sold all of their assets and paid off everything that they owed, half of South African households would sit with minus 16,000. And I think when you have a huge economic shock, your kind of the wealth position that you have really determines your ability to manage that shock. And I think the kind of hugely unequal nature of our society and the fact that half of our households are in a negative equity position, I think it demonstrates how hard it is for those for members of those households to manage a shock of this type. So kind of, although that's what we had, what we also had was for kind of all of our problems, we kind of had a kind of fiscal system where the government was able to tax those in the top 10% of that picture, and basically distribute it to the 50%, and that kept the society reasonably operating. We could keep the society going by the fact that we were able to do these transfers, and for all of the structural problems, at least the society operated. What I think COVID has done is to break down or kind of break this system from operating. So what you've had is a huge additional increase in unemployment. From a gender perspective, there's a large number of South African women who kind of earn their income in the informal economy, who sit in that 50%. they've had their entire livelihoods cut off, and those households have kind of have been sent into pretty deep poverty. And I think Daniela will show us some of that. We've had a huge increase in unemployment, a massive fall in our GDP, and a massive fall in the taxes that the state can collect. So the macro system that really sits behind this, which allowed the system to keep functioning, I think has broken down. And I think that throws up huge kind of questions about how we're going to rebuild this economy. How are we going to get this economy to grow in a way that larger proportions of that 50% who are in a negative wealth status get to earn money from employment, kind of economic system where unemployment's probably going to go up from about 35 to closer to 45%. How are we going to get growth to change that? How are we going to change this kind of underlying sort of pattern of inequality? And thirdly, how are we going to kind of extend this kind of fiscal system, which has allowed the transfers to happen, and to keep the to kind of keep the society going in a sort of context where you have taxes going down, but your requirements to spend are going to go up. And I think it's this conundrum that I'm really thinking about. And I think when we start to talk, we can start to talk about some of the solutions in my mind. But I thought I'd kind of use the time at the start to just set up to kind of set out the problem. So I'll stop there, Richard.
Imraan, thank you very much. And let's directly now hear from Daniela, and then we can engage. Daniela, over to you. Thank you.
Great, thanks, Richard. Yeah, I would like to respond to some of Imraan's points, I think, but maybe not now. Let me use my couple of minutes up front to share with you some of the work that I've been involved in over the last couple of months, which has tried to really shine a light on women and how this crisis has affected gender inequality in South Africa. So already quite early on in the pandemic, a number of people were predicting that this was going to be a pandemic or crisis that would hit women particularly hard. So in previous recessions, men have tended to do worse. In fact, the 2008 Great Recession was coined a man session because so many more men lost their jobs than women. But quite early on in the pandemic already, commentators were referring to this as a she session, right? Recognizing that it was going to be women who would probably be hit hardest. And the reason for this, well, Imraan already raised one reason, which is that many women are in vulnerable jobs, like in the informal sector, and they were locked out of their employment. But another key reason is that many of the sectors that have been hit really hard in this crisis have been the same sectors that are typically large employers of women. So, think non-essential retail, tourism, hospitality, personal care, domestic work is a big one. Many of these jobs cannot be performed remotely and have been really severely affected by lockdown restrictions in place by governments across the world. So the predictions were that women would suffer more, and as the early data started emerging from a range of countries, that prediction has been shown to be true. In South Africa, we have some early evidence coming out of what's called the NIDS-CRAM study that I was involved in. Now, some of you may have heard of it. We don't have access to our usual national labor market statistics yet. Those are those big surveys have been put on hold for the moment. And so a group of us got together quite early on in the pandemic, late March, to try and think about how we could track the socioeconomic impacts of the crisis on South Africans' lives in a way that would produce nationally representative data to the best of our ability. And what emerged from those discussions was this NIDS-CRAM survey, which tries to get at a representative sample of South Africans by interviewing a subsample of people from a pre-existing longitudinal survey called NIDS, which some of you may have come across already. So with this, armed with this data set, we were able to, we think, produce the best estimates available to date of what was happening in the labor market after this massive shock that occurred around March, April. And one of the key findings emerging from the survey was that women had suffered the most from the job losses. So I think a pretty startling estimate that gained a lot of attention in the media was that of the 3 million jobs lost between February and April, so looking particularly at that period characterized by the very hard lockdown, women accounted for 2/3 or 2 million. Right? That's a massive disproportionate effect if you consider that pre-COVID in February, women accounted for less than half of employment, right? So less than half of employment, but they accounted for almost 67% of the job losses that occurred in that pretty short space of time. In addition, among the employed, those who held on to a job over the period, women saw much greater job losses, much greater drops in hours worked than men did, right? Another important point to make is that not all women were affected negatively in the same, well, all women were affected negatively, but some women took a bigger knock than others. And as we would expect, this crisis is really exacerbating pre-existing inequality. So we saw that among women, it was African women, those without a tertiary education, and those really at the very bottom of the earnings distribution who were most likely to lose their jobs. Then at the same time that you've got this massive shock happening in the labor market, of course, there was also a concurrent shock occurring in the home with school closures and pretty much the suspension of all childcare facilities in that first month of the lockdown, which we measure. There would have been a massive increase in the amount of unpaid care work that would have had to happen in the home. And it's work typically done by women, right, in South Africa and globally. And so when the childcare shock occurred, it's, I guess, no surprise that women took on more of this additional childcare work. And our data, which collected a bit of information on time use, showed this. It showed that women were not only more likely to say that they were spending extra time on childcare, but they were spending much longer hours than men. Part of this has to do with living arrangements in South Africa, that women are just that much more likely to be living with children than men are. But even if you look at men and women who are living with children, you see women taking on more of this additional burden of childcare. Now, linking this back for a moment to what's happening in the labor market, if women are responsible for more of this extra load in the home, it's going to have implications for their ability to go out and work, to work long enough hours, and to go out and search for work eventually when that opportunity arises. And so I think it is of great concern to those of us who've been tracking women's position in the labor market over the last 25 years or so, that some of the, the hard-won gains are being quite quickly eroded in such a short space of time. I will stop. Well, let me rather just take, if possible, one more minute to share with you some of the preliminary findings now from the second wave of NIDS-CRAM. I know I'm reaching my time limit here. The results from the second wave of NIDS-CRAM are going to be released towards the end of this month. So really, these are just some preliminary findings which have not yet been made public officially. But what we see between April and June, when June was the next kind of key period that we measured, is that actually not much happened, unfortunately, in the labor market. If anything, women may have gained back more jobs relative to men, but the numbers are so small as to be almost not statistically significant. And so perhaps we will be seeing a much bigger recovery in the labor market in August, September, when we go back to interview households, because by that stage we'd moved to a much less restrictive lockdown level. But between April and June, not much was going on in the labor market. In terms of what was happening in the home, childcare hours went down between April and June, right? And that was to be expected, because in June, some grades of school reopened and domestic workers and childminders were able to go back to work in private households. But what's been very interesting for us is to see that while both men and women have cut back on their childcare hours a bit in June compared to April, men are returning to their pre-childcare levels faster than women are. And I think why this is interesting is because there'd been a lot of talk initially that this massive childcare shock would expose the importance of childcare work in the home, work that's typically done by women, and that many more men were starting to come to the party. They were also doing more childcare work over the lockdown, and maybe this would have a transformative effect in society. Men would continue to do more childcare work as time passed, because they would have formed new attachments with their children, or to use a phrase often used on the factory floor, they would learn by doing, right? And so they might continue to take on more of the childcare. But what we're seeing now from our second wave of data is that this is not looking so hopeful anymore. Men are returning, as I said, to pre-COVID levels faster than women. I'm going to stop now, other than to say that obviously this is a story we're going to carry on monitoring. We hope to have 5 waves of NIDS cram over the course of a year. And also by that stage, we should be seeing our national labor market statistics coming back online. And so this is something that I think is really important for researchers to track. Thanks, Richard. I'll stop there.
Thank you, Daniela, and thank you to Imraan for your inputs. We're going to turn to a couple of questions in the Q&A, but first, I'd like to just ask you both, if I may. This is a webinar series that essentially looks at our interconnectedness ultimately as human beings, and I wonder if you could both of you just reflect very briefly on from a professional point of view, but as a human being in a personal capacity, how is this COVID-19 crisis shifted your view in any way, or underpinned your view, or changed anything in terms of how you're looking at things? Has it at all? And I mean, a crisis always pushes us to think through things differently and the like. Has it done so in your cases at all? Imraan?
Imraan, you're on mute.
As I've tried to suggest in the comments I made earlier, I'm quite preoccupied with what is the basic system that has kept our society operating, and I think what I take from this is that the kind of deeply unequal society that we have, and if we measure it on kind of income or wealth, that there's a deeply unequal kind of system that is just very fragile, in a fragile way, being held together through enough transfers. That a key part of that inequality, I think, is the gender inequality in our society. I think these kind of questions that sort of Daniela has raised about the patterns of employment, the patterns of how this economy operates to kind of favor those who are men, firms that are large, etc. So the kind of breakdown in in that system is kind of something that has been kind of truly kind of challenging. You know, lots of the things that I mean, prior to COVID-19, I think if we were having a debate about a kind of basic income grant, I don't think I would have been a supporter. I would have said, no, we should be moving this economy towards kind of creating employment for larger numbers of people. I think what it's exposed is how fragile our social protection systems really are, and kind of even within that, how much of gender kind of gender bias or kind of gender inequality there is in it. So I'm certainly starting to rethink my views on what is the nature of the social protection system that we have, and in what way should we be rethinking that?
Thank you, Imraan. Daniela, and your thoughts, and you wanted to raise a couple of issues around Imraan's inputs as well, if you would like to. But on a personal level, on that first question.
I absolutely agree with Imraan on the issue of social protection being so important at the moment. I also agree that, you know, a job is first prize. I think we all agree that. I think most grant holders would agree with that. But our economy hasn't created enough jobs in the last 25 years. And now, you know, we had 10 million unemployed people pre-COVID, and now many more will be added by the end of this year. And so I think we have to take a closer look at our social protection system. Until we create more jobs, we need to protect people's livelihood. Well, we need to protect people's income within their households, their ability to feed their families. And I think that our NIDS crime data showed some really pretty alarming statistics in terms of almost the degree of destitution families were experiencing. Almost half of women said that they had run out of money to buy food in April. Now, and I think it was about 1 in 5 women said that someone had gone hungry in their household in the previous 7 days. Now, I'm not surprised by this when I look at the slide that Imraan put up right at the beginning. You know, I think what we learned, an important lesson we learned in this crisis, was that there's no time to waste. When a crisis like this hits, you have to get income support to households immediately. They don't have any fat in the system. People are living day to day. There's no, you know, we waited a month before there were grant top-ups. And I think that we did, you know, the poorest in this country a disservice by waiting even a month. The second thing I'd want to raise is that what this crisis has exposed is that our social protection system has got big holes in it, particularly for the working age. So, you know, we have a good social protection system in place for the elderly, for children through the child support grant, but for working age adults, we don't have much. What we see is the new initiatives that have been introduced during COVID times, so the UIF2 scheme and the new social relief of distress grant, that there are still biases, which Imraan mentioned. So if women are overrepresented in unemployment and overrepresented in the job losses, they're underrepresented in the UIF2 beneficiaries. They make up only 40% of those beneficiaries, and they make up only 30% or so of the new COVID grant beneficiaries. And I think what this is exposed is that women are not gaining access to these programs because they are less likely to be registered for UIF in the first place. Imraan alluded to the fact that they have different kinds of jobs which wouldn't get them on the system. But they're also being prevented from accessing the new unemployment grant because it can't be held concurrently with existing grants. And women are much more likely to hold a child support grant than men are, right? Because they're more likely to be the primary caregivers to children. So I think what this crisis has exposed is that we are in a way unfairly allowing women to access the social protection system through their role in caregiving rather than in their own right, right? And I think that's something that we should be exposing and we should be thinking about very carefully. And perhaps this is a time when we should be having a discussion about a universal basic income grant so that no one is left behind. I'll stop there, and I'm sure Imraan may have some thoughts on the basic income grant.
Absolutely, thank you, Daniela. And I mean, there is, understandably, there's real interest in the NIDS-CRAM study that you've been involved in. And just to ask two questions from the chat quickly. One, were migrant women involved in the study? If so, were they affected vis-a-vis their South African counterparts? And secondly, just more generally looking at the sectors in which the study looked at overall, and the gendered experience is distinct in each of those sectors.
So the first question about migrants, it's not that migrants were not included. So it was a representative sample of people living in South Africa. But because the sample size was relatively small, about 7,500 observations, it wasn't possible to drill down deeper into, how were migrant women being affected compared to non-migrants. And we didn't collect information specifically on migration status. By migrants, I'm assuming you mean external migrants, foreign migrants. And the reason for that is because we also didn't want to scare people off from answering questions, right? Given the real sensitivities around foreign migration in South Africa. As to the second question, what sectors were hit hardest? Unfortunately, we weren't able to ask detailed information about industry or sector of job. We could get a sense of where on the occupational distribution people lay, but not, for example, where they were working in the restaurant industry versus the personal care industry. But what we could say from our data was that the women at the lower end of the occupational distribution were affected. So people in low skill jobs across a range of sectors. In the second and third waves, we have managed to eke out a little bit more time to ask questions about sector. So that information will be forthcoming. Recall, we only had 20 minutes in a phone survey to get as much information that we could. And so there were some things that just simply couldn't be asked in that short space of time.
Such critical work, and not least on the back of the very powerful figure of the minus 16,000 for the bottom 50%, Imraan, in terms of net wealth. And I note that there's a question in the chat as to just how that figure is determined, what's included, what isn't, in terms of understanding or coming to that particular figure.
So that's coming from a kind of paper that's been done by colleagues of ours in the kind of inequality center, and the methodology behind that's really kind of using household surveys where people would respond to kind of questions about their assets and liabilities, and then kind of summarizing that into a calculation about the kind of assets and liabilities of different households depending on kind of where they're sitting in the wealth distribution. And that's the kind of basic idea behind behind that work. If I could just use the time to kind of respond to a few things that kind of Daniela's raised. So I mean, another way to think about the gendered employment impacts would be to think about, so to kind of think about which kind of sectors of the economy have been the most affected by the lockdown. And we've done some work looking at what are the kind of gendered patterns before the lockdown, and then if we assume that the lockdown operated exactly the way policy makers intended it to operate, what do we think the employment impacts would be? And the kind of suggestion from that work is that there's a double impact on women. So the first impact is one where just by the fact of being lower down in the income distribution, you're more vulnerable, you much more in kind of in the informal, in lower parts of the informal economy. So because you low down in the income distribution, you're going to kind of have a huge, a larger impact than those at the top end. And then the kind of second effect is a sector effect. So based on the distribution of jobs by kind of gender, as Daniela said, that the patterns of employment by gender are that women tend to be in services in the informal economy, etc. And those are the sectors that have been the most hard hit by the lockdown for the longest amount of time. So I think when the data comes out, I'm not going to be at all surprised to see a kind of disproportionately negative impact on women, and kind of especially women at the lower end of the income distribution.
Thank you, Imraan. And yeah, sorry, forgive me.
No, I was wanting to raise another point as well around the kind of social protection system. I think, unfortunately for us, we kind of entered the pandemic at a time when we're in a pretty poor fiscal state. So the kind of government's fiscal resources were kind of already under strain, and you enter a huge shock where you need the government to act decisively. I think when you constrained in that fiscal space, I think it's much harder to do the types of social protection that I think we would all like to happen. That's the first point. The kind of second point is that we've also got to ask the question about the capacity of the state. I think I kind of agree with Daniela. It's the fact that it took us more than 1 month to get top-up grants paid, when it was absolutely clear that those households were in absolutely severe absolutely severe economic crisis, tells you something about the capacity of the state to do these things. And if we look at how this COVID grant is not being paid to kind of households where it should be paid, all of the huge administrative problems kind of claimants are having, I think it's a real kind of problem that we have to address in our society.
I'm seeing in the chat, Imraan. David, forgive me, it's rather big on David Caldwell mentions. I think he's speaking to the politics of the matter and versus the economics as well, and whether that is indeed a driving force with respect to the challenges that we face at the moment. And just in light of that, I wonder if you could comment, Imraan, on the private sector's role. Is there a role for the private sector, and potentially Daniela as well, for them to be taking on a particular role with respect to building the protection and the resilience and looking more of a targeted approach? Any comments on that from either of you?
Imraan?
Daniela, do you want? No, you go first and I'll come after you.
Okay. Well, I guess, what I read from David's comment there was that, how much faith do we put in the government, given, capacity issues over the last while? And for me, when I see a comment like that, it almost reinforces my belief that we should be expanding our social protection system, because I think quickest and least the quickest route to get money in the hands of people who need it is through the grant system. I would say that there's the least leakage through the grant system, whereas the minute you try and start up projects in other areas where the government has a larger hand or larger role to play, there's more opportunity for leakages in the system. So I guess, you know, something that I've taken away from this crisis is that we would be in a way better off just putting the money directly in the hands of the people who need it most, and hope for the economy to be stimulated through, you know, the well-known multiplier effect. People at the bottom end of the distribution, when they have cash in hand, are going to spend it on generally locally produced basic necessities, which might boost the economy in other ways. So yeah, I mean, I guess that would be my response to the concern around government's involvement. I also agree that the private sector should be playing a role. And I think it's been very interesting, actually, that the private sector seems to be coming to the table increasingly over this period. You know, if I could just raise one more thing in relation to the private sector, taking almost a much bigger view of the private sector than maybe the person who asked the question intended. But really, I think we should be putting back on the table the issue of the wealth tax. Imraan's first slide is really pretty startling. And as he has raised very, I think, importantly, we are fiscally constrained. Our current budget is stretched to its absolute limits. And so maybe we should be thinking more about trying to access new sources of revenue from the private sector. And, you know, for me, that's, you know, all these kind of roads are pointing increasingly towards thinking about a wealth tax. And on that, I'm going to hand it back over to Imraan.
So I'm in kind of agreement. I mean, I think the transfers, you know, kind of transfer money to those who need it. I think the evidence is quite clear that that's kind of highly effective. You're not kind of losing money to all sorts of kind of intermediaries kind of inside the system, and I'm completely supportive of that. I do think that the kind of private sector has a kind of key role to play. I mean, if you go back to my slide, the most striking thing about it is the highly unequal nature of our society, and kind of really in the top end of that wealth distribution, there's a group who are sitting with net assets of about 18 billion. So that's the nature of the inequality in our society, and that, I think that kind of inequality is being kind of produced by a particular kind of set of kind of activities in the private in the private sector. So I think it's about time we start to talk not just about minimum wages, but also about maximum wages. You know, the types of incomes that some people in the private sector earn are just completely unspeakable, and I think we have to start to put some controls or kind of over that. I think the wealth tax is kind of really an idea that we should start to push. We're not going to get large amounts of fiscal income, so government's not going to make a huge kind of amount out of it. But it's a start of a system where we have a national database on what kind of wealth we all own. And I think if we want to change this economy, and we want to kind of have a kind of economy that manages the next big shock, the better than we've managed this one, then that picture has to change, and we have to have, we've got to think about economic and social programs that's not kind of reinforcing the pattern of inequality that we have. And I think for the last 25 years, what we've had is a pattern of growth that has simply reinforced that kind of inequality. Now we kind of have to confront the fact that we can't run the society on that basis any longer. And I think we all going to have to make some huge adjustments to how we run our lives. And I think the private sector has a kind of really key role to play in that. Like Daniela, I'm kind of really pleased that there seems to be some sort of consensus emerging in business, labor, and the government that we have to reconstruct the economy in a way that starts to address this. But I want to stress, I don't think it's going to be an easy process. I mean, just one bit of information. How long will it take us to get back to where we were prior to the crisis? And the emerging consensus seems to be we'll get back to 2018 probably only in 2025. And I think the next 5 years are going to be really, really tough and kind of huge choices that we have to make as a society.
So difficult times, but I'm sure Karine, for her question on the private sector, and Cheryl with regards to the wealth tax would agree that the innovations are required. I guess, I mean, there was a question around just how much can the wealthy bear, but that database that you were speaking of potentially can help us to understand some of that and move forward from there. Okay, debt, other innovations have been asked around, or questions, I beg your pardon, around what's termed as the Cheryl as well, around a debt jubilee that for the poorer households and the smaller businesses. Again, speaking to some of our the innovations that might work. Imraan, a quick comment on that?
Yeah, I mean, I kind of think we're going to have to make all sorts of allowances for kind of households that are unable to meet their kind of debt obligations. I mean, it does raise all sorts of complicated issues about incentives and things of that sort. But I mean, we're in such a crisis that I think we kind of going to have to think outside of the box. But I do want to place one counter that we can't only be thinking about policies of redistribution and policies of wealth taxes, etc. We kind of also have to have a lot more thinking about the nature of economic growth. You know, the kind of only real way out of this crisis is to get the economy to grow, and I think there are potential big items that can get the economy to grow. So things like the kind of release of kind of spectrum. I'm a kind of supporter of much kind of higher levels of investment in infrastructure. You know, I mean, it's not great, but the one thing that we still have is that we kind of have a sort of country with massive distribution of economic infrastructure. That is fixing that is kind of creates huge potential for growth, not just by itself, but in kind of allowing that infrastructure to kind of create economic opportunities for large numbers of South Africans, kind of especially female South Africans, to sort of benefit from growth, and to change the kind of patterns of growth, so that much more goes to new entrants, much more goes to those at the lower end of the distribution.
I'm sure Marietta will be happy that we're not just looking at redistribution policies, and she makes the point that will the wealthy not just pack up and leave the country after quite a significant exodus already of families. So we hear you with respect to having to have a multi-pronged strategy. Colleagues, we've got just 7 minutes left, and I do want to keep to time. I wonder if we just perhaps to turn to you, Daniela, just with respect to just a quick question around national health insurance. I mean, with your thinking around the gross inequities that are at play here in South Africa, where how do we need to take into account those and the with respect to structuring and moving forward on a national health insurance? Everyone speaks about the universal access being so critical, but do you want to give us a couple of thoughts on that?
Well, this is certainly an area that I don't know enough about. It's a really complex area in terms of financing and also implementation. But something that does worry me, that's come up, I guess, repeatedly of late, is that citizens don't have much confidence in the government to provide good health care. And the procurement that's occurred around the pandemic has certainly, in my view, made this an even more thorny issue, right? And so, yeah, I mean, in an ideal world, I would very much like to live in a country, in a society where we have a national health insurance. But I think that the government has a long way to go to convince people that it should be trusted with large sums of money and centralized procurement and distribution of healthcare. So yeah, I mean, I guess like many people, I feel those same concerns. I was chatting to Catherine about this in our kind of pre-meeting, and to take it back to the social grants. I know I'm harping on about the social grants here, but in some respects, I would feel more comfortable to put money into the hands of people so that they can use it in ways that almost keep them out of the health sector to begin with. I'm sure that you're a proponent of the social determinants of health. And, I would imagine that if we can feed people, provide them with a basic minimum level of living, standard of living, there is more chance that they can lead healthier, better lives. Of course, we still need a well-functioning health system. But I think that, as Imraan has said, we face some terrible, terrible trade-offs going forward. There are limited funds and great need. Yeah, there are no easy answers to that. I'm going to stop and let Imraan also weigh in on his thoughts on the NHI.
So I'm no expert on that question either, but I think I'd feel safe saying this, that it's quite clear to me that the existing system doesn't work. That you have this kind of dual system where you have large numbers of South Africans on the one hand drawing on limited resources. You have a kind of private system, which I think some of us who are in that system thinks it works. It's kind of actually hugely kind of expensive and doesn't really deliver the services that it should. And I think you have this mal-distributed kind of resource base. So the kind of idea of integrating that system makes a kind of huge amount of kind of sense to me, and I think the pandemic took us along that path, and I'm kind of hopeful that we can resolve some of those issues. But I think the kind of issues of trust and procurement kind of really have to have to be resolved. You know, the fact that money for kind of PPE has been kind of stolen in the way that it has, I think is just kind of truly symbolic of how broken our society is.
Thank you. And we've got 2 minutes left, and so I'd like us to draw us to a close. If I can just reflect on how, as a simple healthcare worker, health sciences educationalist that I am, and on Tuesday we closed the intermediate care section of Nasrec Field Hospital, and there was a real sense, and we'll be talking about that again next week in the primary care healthcare webinar. But there was a real sense we had healthcare workers had of in essence a sense of relief in some ways, a sense that we could now just retrospectively look back a little bit on the work that had been done, that the wave had been coming down. But I'm reminded for our discussion today that perhaps from an economic point of view, we're not on the downturn of the wave. It's so much there for all of us. And yes, from a health perspective, the second wave might come, but really it's an ongoing challenge, an ongoing problem when we look at it from a health perspective. And I really take that message from you both. We don't want the broad economic policies and plans that are necessarily, they don't have to be blunt instruments, I'm also hearing from you. And that both of your work that you're doing is really sort of rubber hit roads kind of work that is so critical to being able to inform some of the plans and some of the answers that we need. So, and lastly, just I spoke of us as being in a system as human beings, all coming together through looking at it through different lenses, but human beings, yes, and gender identity aside, we're fathers, mothers, brothers, sisters, we're all in this system together, but perhaps it's more about mothers, wives, sisters, girls, we are women, hashtag, that we need to be thinking through appropriately for the inputs of both of you today. So I'd like to say thank you very much to both of you, really, for engaging so nicely with us today and giving us your insights. And indeed, thank you to everyone else who's participated today. To remind you that our next webinar will be at 1 to 2 next week, where we're going to be looking at primary healthcare and that in the context of COVID-19, the lockdown and the work that's been done. I also want to remind you of the website, www.wits-wetu.org. And I would hope that what we'll be doing is putting the presentations and a number of resources and references to the works of our eminent speakers today and in the next webinars that people can access, and that we can, through that website as well, we're looking to keep the conversation going and through the registrations for these webinars. And I look forward to us all engaging considerably in the next few weeks. And so please, I invite all of you to attend the webinar. But lastly, just to thank you all and thank you to our speakers. Colleagues, thank you very much.
Thanks for having us.
Thank you.
Thank you so much.
Thank you, Imraan. Thank you, Daniela.
Okay, cheers, everyone. Cheers. Thank you.
That was
Bye.
fantastic. We'll keep a record of all the comments.
Cheers. Bye-bye.
Thank you.